don't make any bones about it, my friends. This is it. This is breaking point. You know, since the election of Donald Trump, we've seen a re-explosion of protest. We must stand together. We must unify our voices, and we must save the NHS. My friends, this is it. We will lose this service forever. And these badly paid saints, these angels, these people who the Commonwealth funds in Washington say have created the health service that is the best across the entire world, must be looked after. Put your hands in the sky if you support the NHS, if you will stand with me, with doctors, with nurses, with paramedics, with care workers. Thank you. As Nelson Mandela said, it always seems impossible until it's done. We can do this. Salute.
If you're sick and feeling ill, they'll do their best, you know they will. And if your wounds prescribe your pills and save our NHS. Wise up before you grind your axes, paid for by people's taxes. Now you know just what the facts is, save our NHS. God bless the NHS, the doctors and the nurses. God bless the NHS, our National Health Service. It's overworked and it's underpaid. We still love it anyway. Make sure that it's here to stay. God bless the NHS.
We've come from Huddersfield today. We've come down on the train this morning because Huddersfield's losing its A&E department and also our hospital. And it's part of the NHS. You know, these STPs that are coming in mean that the country will lose 22 billion off its NHS budget. And there are hospitals up and down the country that are losing not only A&Es, but they're just closing. And, you know, we want to fight for our NHS.
You know, as a GP, I think it's quite difficult to manage because we've got not enough staff and a lot of patients. We can't keep up with the demand. So the patients can't get appointments, and that's not their fault because we haven't got enough staff. Certainly when I was in the hospital, it was dangerously understaffed. The last time I worked in the hospital was about 18 months ago, and even then it was dangerously understaffed, and I dread to think what it's like now.
Just come here today to really show support of how important the NHS is for us. For all people, regardless of what their circumstances are, we have to save the NHS from privatisation. It shouldn't be treated like a business. It should be a human right, and everyone should be entitled to free healthcare at the point of service. And the way that the current government is privatising healthcare is a shame. They're underfunding it, and then they're saying it's not working.
Yeah, there's a lot of stress, and people going off sick with stress, and people struggling to come to work and finding it upsetting because they're not able to do what they want to do. You know, they're kind of running around and not doing the job properly, and that's a worry when you're dealing with quite risky situations. So yeah, it's stressful when people are trying to do a good job and there's not enough people to do it.
We've come to defending the NHS. We're very passionate about it.
Our local hospital is being closed.
Yeah. In Paynton.
And we're losing beds at Torbay. We're losing stroke beds, we're losing maternity beds, neonatal beds, paediatric beds. Paynton is actually closed, and we had the awful news this morning, not just out of our area, but Holsworthy has been closed overnight because of staff shortages. However, the people of Holsworthy were out on the streets all night because they believe that hospital will be closed forever. So Devon is a rural area, and we are losing hospitals very fast, and people are either too disabled or too poor to be able to afford fares to travel such long distances. So we are here today to try to defend our NHS.
Yeah, save our hospitals.
We're here because we want to save the Glenfield Heart Unit, but we see it's connected to saving the NHS as a whole. So we're continuing our fight. There's a consultation over the Glenfield Hospital still going on, and we ain't going to give up. We're going to save this heart unit.
We're Psychologists Against Austerity, and so we're a group of psychologists, but also other mental health professionals, and we're obviously against the cuts that the government keep making, because we know as psychologists working in the NHS what a detrimental effect it has on people's well-being and their health. And we think it's really important as professionals that we come out and say that, because we deal with the stories that people come and tell us every day. I mean, there's increased pressures obviously within the NHS, but this is broader than that. There's so much research to show that the psychological impact of austerity in terms of people feeling shame, if they're on benefits, and the cuts to benefits and how that impacts how they feel about themselves, but also their agency, their ability to do things. There's lots of humiliation. We know that there's higher rates of mental health problems. So it's not just about NHS services, it's much wider than that.
Politicians, open up your eyes. It ain't yours to privatize. You don't own it, now realize it's our NHS. Try to sell off what's not yours to sell, and it's for sure we'll all rebel. Take this advice now, please pray tell, and save our NHS.
We're from Health Campaigns Together. This is Dr. Louise Irvin from the Save Lewisham Hospital campaign. This is Keith Venables from Derbyshire. I can't see who's on the end. I'm not sure if I know the people on the end. And we're the people who first called for the demonstration back in October. There's about a dozen of us in the room, and it's turned out pretty well, hasn't it? We've got a huge number of trade unions that have given their official support and pulled along delegations today. A number of them have given us very generous donations, but I think we've really struck a chord. So we wound up with people from Northern Ireland, Scotland, all over England have come, and it really is, I think, the moment where people realise the NHS is in danger. If we don't fight now, terminal damage can be done to our health services, and that's why people are fighting back.
To Portsmouth, Durham to Devon, Brighton to Birmingham, Medway to Manchester, Newcastle to Nottingham, Calderdale to Cardiff, Hastings to Huddersfield, and also from Scotland and Northern Ireland.
Travelled up from Lewisham, which isn't very far, so we're not. We remember obviously only marching a few years ago to save Lewisham Hospital, and it worked, but only because we had huge people power and incredibly clever people that could that could give the arguments to the government. And if we had just lain down, it would have been closed. So that was the A&E and the maternity units that were going to be closed. Just after as well, sorry to go on about Lewisham, but just after the maternity unit had just had a whole refurbishment costing millions of pounds, it was almost as though, to be cynical, it was all ready just to sort of be sold off and be sort of handed over. And we were not going to stand for that. It's our NHS.
We're marching to save the NHS because the Parliament are cutting the funding for it. Like the idiots they are. So we marched from Tavistock Square to save the NHS that we need.
And also they're cutting the funds, and we need the NHS, because without them lots of people might not live and stuff.
Yeah. The government is committed to renewing the Trident nuclear arms scheme. Those weapons are absolutely useless for security. They're immoral and they're wasteful of money, because it's going to cost public money, our money, 205 billion. That's £1,000 million for that project, and yet the NHS is dying on its feet.
They say there's not enough money for the health service or education or housing, all that kind of thing. But when it comes to nuclear weapons, like Ray was saying, or when it comes to war, it seems there's a bottomless pit that they can draw on. So we can only conclude there is plenty of money out there. We're a wealthy country, one of the wealthiest in the world. If the government chooses to spend money on a top-class health service, on jobs, on education, free university education, it could do so. So that's our message today. We want the government to end these rotten pro-war, pro-nuclear policies and spend on the NHS.
Healthcare for one and all is free is what we got here in GB. I'm begging please down on my knees, save our NHS. God bless the NHS, the doctors and the nurses. God bless the NHS, our National Health Service. It's overworked and it's underpaid, but we still love it anyway. Make sure that it's here to stay. God bless the NHS. God bless the NHS.